Cerebrospinal fluid, or CSF, is a clear liquid around the brain and spinal cord. It cushions these delicate organs from bumps and helps keep pressure stable. CSF also carries nutrients in and removes waste out. The body makes new CSF every day and absorbs it back into the blood. If CSF flow is blocked, pressure can rise and cause headache, vomiting, and vision problems, called hydrocephalus. Infection of CSF is meningitis, which can cause fever, stiff neck, and confusion. Doctors can test CSF with a spinal tap to find causes of nervous system illness. Fast care can often save lives.
Lymph is a clear fluid that leaks from blood vessels into tissues, then returns to the bloodstream through lymph vessels. It carries extra water, proteins, and fats from the gut. Lymph nodes filter lymph and trap germs, helping the immune system. If lymph flow is blocked, swelling called lymphedema can happen, often in an arm or leg. Moving your body helps lymph move because lymph vessels do not have a strong pump like the heart. Infections can make lymph nodes swell and feel tender. Doctors may check nodes to look for infection or cancer spread. Skin care lowers infection risk.
Blood is the red fluid that moves through your heart and blood vessels. It carries oxygen from the lungs and nutrients from food to every cell. It also takes away carbon dioxide and waste. White blood cells fight germs, and platelets help stop bleeding by forming clots. Blood keeps body temperature steady and moves hormones to their targets. When you lose too much blood, you can go into shock. If blood is too thick or clots form, it can cause stroke or heart attack. Iron and protein help make blood, and tests can check levels.
Sweat is a watery fluid made by sweat glands in the skin. Its main job is cooling. When sweat evaporates, it removes heat and prevents overheating. Sweat also contains salts and small amounts of waste. Some people sweat more due to heat, exercise, stress, fever, or hormones. Too much sweating can cause dehydration and low salt, leading to cramps or dizziness. Too little sweating can be dangerous in hot weather. Strong body odor happens when skin bacteria break down sweat. Drinking water, wearing clothes, and washing skin help. Sudden night sweats or unexplained sweating should be checked by a doctor.
Urine is the liquid waste made by the kidneys. As blood passes through the kidneys, extra water, salts, and waste chemicals are filtered out to form urine. Urine helps control fluid balance, blood pressure, and acid levels. Normal urine is pale yellow, and the color changes with hydration. Painful urination, blood, or a strong smell can signal infection or stones. Very dark urine can mean dehydration or liver problems. Not making enough urine can be a sign of kidney failure. Drinking water, controlling diabetes and blood pressure, and avoiding kidney-toxic drugs protect urine-making organs. Testing if symptoms persist. Synovial fluid is a slippery liquid inside joints like knees, hips, and fingers. It acts like oil in a machine, letting bones glide smoothly. It also feeds the cartilage, which has no direct blood supply. When synovial fluid is low or the joint lining is inflamed, movement becomes painful and stiff. Arthritis is a common cause. In gout, crystals irritate the joint and cause sudden swelling and heat. Infections can also enter a joint and need urgent antibiotics. Gentle movement, healthy weight, and medical treatment help protect joints and keep synovial fluid working well. Ice can reduce swelling during flares. Pancreatic juice is a fluid made by the pancreas and released into the small intestine. It contains enzymes that digest protein, fat, and carbohydrates. It also contains bicarbonate, which neutralizes stomach acid so the intestine is not burned. If the pancreas is inflamed, called pancreatitis, these enzymes can start digesting the pancreas itself, causing severe upper belly pain and vomiting. Long-term pancreatitis can lead to poor digestion, weight loss, and diabetes. Alcohol misuse and gallstones are common causes. Treatment includes fluids, pain control, rest for the gut, and fixing the cause. Seek care if pain is sudden and intense.
Bile is a yellow-green fluid made by the liver and stored in the gallbladder. It flows into the small intestine after you eat, especially fatty foods. Bile breaks fat into tiny droplets so enzymes can digest it. It also helps the body absorb vitamins A, D, E, and K. Bile carries waste like bilirubin out of the body, which gives stool its brown color. Gallstones can block bile flow and cause sudden right-side belly pain, nausea, and jaundice. Treatment may include surgery to remove the gallbladder. A balanced diet can lower risk. Dark urine can be a sign. Gastric juice is the fluid inside your stomach. It contains acid and enzymes that break food into smaller parts. The acid kills many germs that come with food. A thick mucus layer protects the stomach wall from its own acid. If this protection fails, ulcers can form and cause burning pain, nausea, or bleeding. Too much acid can cause heartburn and reflux, where acid moves up into the throat. Medicines like antacids, acid blockers, and antibiotics for H. pylori can help. Eating smaller meals, limiting alcohol, and not lying down after food also reduce reflux. Seek care for black stools. Saliva is the watery fluid made by glands in your mouth. It keeps your mouth moist, helps you speak, and starts digestion by breaking down starch. Saliva also protects teeth by washing away food and neutralizing acids. It contains proteins that fight germs and help wounds heal. Dry mouth can happen from dehydration, stress, smoking, or many medicines.
When saliva is low, you may get bad breath, cavities, mouth sores, and trouble swallowing. Drinking water, chewing sugar-free gum, and good dental care can help. Doctors may check for Sjogren's syndrome if dryness is severe. Tests can show infection too.